On Monday, June 9th, Health and Human Services Secretary Robert Kennedy fired all 17 members of the Advisory Committee on Immunization Practices. This panel, composed of professionals, doctors, and public health experts, advises the CDC on who should be vaccinated, when, and against what. Kennedy subsequently announced 8 new appointees, including some notable vaccine skeptics and others with no vaccine expertise. Considering Kennedy's own well-known skepticism of vaccines, it's hard to be optimistic as to how this will play out. Vaccines were first developed in the 18th century to protect people against deadly diseases like smallpox, polio, measles, and the flu. They've proven to be one of the greatest public health achievements in human history and have saved millions of lives. They're one of the pillars of our healthcare system. Let's not forget how quickly the CDC was able to develop a vaccine against COVID in record time, much of it guided by the expertise of this advisory committee. We cannot afford to kid ourselves about the possibility of a new pandemic. Right now, for example, bird flu, H5N1, has already jumped from birds to cows and from cows to people. It's only a matter of time before that or another deadly virus becomes a pandemic. But whether that happens tomorrow or in 5 years, the need for expert, evidence-based public health guidance is more urgent than ever. Even now, we're seeing the terrible consequences of vaccine hesitancy. Recent measles outbreaks have resulted in tragic and entirely preventable deaths of unvaccinated children. We should all be alarmed. We need to demand leadership based in science and accountability.